You're listening to ABC News.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, everybody. Good morning, John.
Good morning, Doctor. How are you?
How are you? And
well.
We welcome all our listeners. It's bright and early.
It sure is. Yeah, just after 5, Saturday morning. So
Maybe
we
it's
are
early, but not so bright.
Yeah, I guess it's still pretty dark out, but that's what we get. We are live and local.
We're live, and you're welcome to call us if you have questions. We're at 800-848-9222. 800-848-9222. You're welcome to call us. I will have some general information because a lot of people ask questions, and I want to answer their questions, hopefully in advance to make it more convenient. We're a private cancer treatment center in Manhattan, which means that we work for you, not the drug companies and not the hospital boards, but for you. We have information available. We have happy to send booklets about brain tumors or prostate cancer or about body cancers to you with a DVD. You just have to call us at our own office phone number, which we'll give you during the course of the show, or you can call us and get more information. The best thing really for people with cancer is to make an appointment, because when we sit down and spend an hour or two, we often see things that the patient doesn't even know existed.
Yeah.
We have some patients, they were never told what kind of cancer they have, or they don't know where the cancer is, or they never got the best staging. And so sometimes people say, I'll just call you up and ask you a question, which is great. I'm happy to answer questions. But really, when you cut the corners, the patient gets cheated.
Yeah, I can understand, yeah.
And we're going to talk about that today, about how to avoid being cheated, because it's the patient's life.
Yeah.
I mean, we're here fighting for the
serious
patient's
stuff.
life.
I mean,
it's very serious stuff. So our office, why did we set it up at 38th and Broadway? We set it up there because it's super convenient. Almost all the buses, trains, subways go right to us, either Times Square or Herald Square. We're minutes from Grand Central, Penn Station, PATH trains, Port Authority. So all the trains and buses are right near us.
Yep.
So almost we're broadcasting to 19 states. So for people in the tri-state area, you can easily get in a bus or train or drive in. For people from Florida,
New England, Amtrak.
We get a lot of New England calls.
Yeah, I'm sure.
Yes, you can fly in and just take the train into Penn Station. It's really simple. And that makes it important for people who need to get in for care. They don't have to drive necessarily. It's really convenient. We have something called the Urgent Cancer Consultants. Urgent Cancer Consultants. And often you walk down the street and see urgent care, right?
Sure.
But for cancer, often people have to wait months to get an appointment. And so we've made a commitment to our patients that we'll see our patients within one business day.
Okay.
Whether we have to work twice as hard, doesn't matter. We want the patients to get the care, the patients to get the focus, and the patients to get the answer.
Right.
And you'll see from the cases today that a lot of people need some new answers. Sometimes the old answers don't work.
If the cancer is not responding, if the cancer is not going away, it's time for a new answer.
Sure.
And if the treatment isn't tolerated, if the chemo or whatever is not working and it's not tolerated, it's time to think about something else.
Take it back to the drawing board and revise the plan.
And that's what we do. It's time for a change. If the cancer is not better, if the cancer is not shrinking, if the markers, if you don't even know what the markers are, if you don't have a copy of your report in your hand, hey, there's a different way. There's a way of having the patient involved. This is not for someone theoretical. This is for our patient.
Right.
And the patient
Sure.
deserves the reports and the information, copies of the record, and they leave us with all of that. So we think you should give yourself the most chances, give yourself the most choices, and that's why our office's phone number, 212-CHOICES. 212-CHOICES, which people ask, what is that number? It's 212-246-4237. 212-246-4237. And we accept most insurances, Medicare, Medicaid. So
No reason not to call.
no reason.
If you're concerned.
With no reason.
For sure.
So we have a private cancer treatment. We know who you are. You know us. You come in. There's no miles of cold corridors, no strange faces, no oodles of locked doors. No, we know who you are. The costs are less. We accept the insurances. We answer your questions, and we speak with the patient directly. You can speak with the doctor, not the secretary, not the nurse. There's no answering machines. Speak to the doctor directly and get answers. And isn't that nice to know? You speak to the doctor.
It's nice to know when you call a number to speak to the doctor and you get the doctor.
Yeah.
It doesn't happen too often. I think we
forget
can all
about those
agree on that.
machines. Forget about the machines. Speak directly to the doctor. So we have a lot of patients this week to talk about, a lot of news, and I hope we can get through most of it. One man we spoke about during the autumn months, he is a man that I know very well, and he had a mass growing. So what's a mass? A mass or a lesion? Well, actually, it turned out to be a big ball of cancer growing from his parotid gland. Do you know where the parotid is?
No, not familiar with that.
I think that they forgot to put the parotid gland in Playboy magazine.
Okay, all right.
Right? But the parotid gland is a gland that's around the ear on the right and left side.
Okay.
And the parotid gland makes saliva. So if you feel your mouth now, you got some saliva. It's kind of moist inside,
Yep,
right?
sure.
And you need that. You need that to eat and digest food. If your mouth had no saliva, you wouldn't be eating very well. You couldn't put the food in the mouth and have something happen.
Break it down, sure.
So you need that saliva. Well, anyway, our patient developed a mass. It was biopsied. It was found to be cancer in the parotid gland. He went to the surgeon and had surgery because that's all he knew about. And then he came to us to get checked out. And when we checked him, we found actually that the surgeon left cancer behind.
Really?
So it's called positive margins. It means that the cancer was cut through and cancer was left behind. We staged up the patient completely, so we saw his whole body from head to toe. We know exactly what's there. We offered treatment with focused beam radiation called radiosurgery, so we're able to focus on the area where the cancer is, hit that, and leave the patient alone. Do you remember Willie Sutton?
Say that again?
Do you remember Willie Sutton?
Willie Sutton, no.
Willie Sutton was a bank robber,
Okay.
right? And the police caught him.
And where's this going now?
The police said, "Why did you rob banks?"
Right.
And what did Willie Sutton say?
I couldn't tell you.
Willie Sutton said, "I robbed banks because that's where the money is."
Okay. Simple answer.
So why do we do radiosurgery? Because that's where the cancer is. We can treat the cancer without hurting healthy tissues.
Okay.
And that's why we're the first ones in New York to do radiosurgery of the brain. We're the first ones in America, the first ones in the Western Hemisphere to do radiosurgery of the body. We're able to hit the cancer without hurting the healthy tissues. So yeah, Willie Sutton went to the banks. We hit the cancer. And when you hit the cancer, it means there's less side effects.
Sure.
Because when you hit healthy tissue, it's side effects.
Yeah.
When you hit the cancer, it's effectiveness.
Right.
And we want effectiveness. So for this patient, yes, he had prostate cancer. We hit the cancer, got a follow-up test, and he is not only A-OK, but he's happy because he's A-OK.
Yeah, sure.
Fully functional, working
Great.
full-time, never missed a day's work with us, and is carrying
Never
on.
had to spend a night over at your practice, did
Was
he?
home in bed with his beautiful wife.
Yep.
And
Great.
he's happy. I'm happy. He's happy. And his loving children are super happy.
Yeah.
So that's what we do. We do what Willie Sutton did. Willie Sutton went after the banks. We go after the cancer.
Yeah, that's it.
Yeah, we go after the cancer. We have an interesting case, a very interesting case of a man with prostate cancer. This man, 62 years old. He had a biopsy for an elevated PSA, and he had a Gleason 8 cancer. So, of course, the surgeon, named a urologist, does a biopsy of the prostate. Now, some people think, well, because the surgeon did the biopsy, the surgeon should do the treatment, that I have a special relationship, I shouldn't question him. And so this man had the biopsy and then the surgery by the same man. He had an elevated PSA. His PSA was 10.5. His Gleason was 8. He had limited imaging of his body. The surgeon opened him up. He found a lymph node enlarged.
Mm-hmm.
Didn't biopsy it, and removed the cancer, removed the prostate.
Gee.
So what's wrong here?
Well, did he have to remove the prostate?
Well, first of all, and this happened in New York City by a full professor of urology, surgery,
I'm sure
in a
one of
big
the
hospital.
major hospitals we all know.
Okay.
Yeah.
Now, the normal treatment, if the cancer spread to the lymph node, you biopsy the lymph node, you get what's called a frozen section. Frozen section means you freeze that instantaneously. You then have the pathologist examine it.
Right.
If the cancer's traveled to the lymph node, the surgery is stopped, the patient's closed up, and that's it. That's the proper treatment for lymph node positive prostate cancer, because surgery can't take care of the metastatic spread to the lymph nodes.
Mm-hmm.
And you can look at the data, and if you come in, I'll show you our booklet. I'll show you the best surgeon's results with lymph node positive prostate cancer when he operates, and it's actually 0%.
Yeah.
Okay, so 0%. So I'm sure this full professor of urology, of surgery, knew about that. Nevertheless, he removed the man's prostate. He left the lymph node. He did not biopsy any lymph node. The man was never able to recover. He's never regained his sex life. He's never regained urinary control. He's wearing diapers now. This is 6 months later. He comes to us. He heard us on the radio. We got all the data together. We're the first ones to get all the data together, stage up the man, find out exactly where the cancer is.
It boggles my mind, removing a prostate and not having all the information, like
It's
every
shocking.
detail. I would
shocking.
assume you'd have, but
It's
I guess not.
shocking, and maybe he's now questioning everybody because of his experience.
Yeah, sure.
So the normal thing, I don't believe anyone should have prostate cancer surgery, number one. If you look at our data, and we've got a booklet, and you can open up our booklet, and you can see the results. If you go to the best surgeon in America, the best surgeon, you can see our results versus their results, and it's page 7 of our booklet, Prostate Cancer. You just call us during the week at 212-CHOICES, 212-CHOICES. We'll mail you the booklet. You'll see the comparison data. I asked this man, did you ever see a booklet like this? Did the surgeon show you his results before he operated?
Right. Probably not.
No.
No.
Didn't you ever think to ask? Your surgeon's so famous, he's treating thousands of patients. Wouldn't you want to know the results?
Right.
I mean, when you buy a Chevrolet, don't you see the miles per gallon on the side?
Yeah.
Right? You can
Yeah.
read on Consumer Report, what's the history of that car? How many miles per gallon is it going to be? What's going on here?
I don't know.
Shouldn't people be told the data in advance? And that's what we're talking about. Inform the patient. You come to me, this man had a PSA 10.5. With surgery, the success rate was 72%. With us, it's 86%.
Wow.
19% better. There's 250,000 men with prostate cancer a year. 19% means 50,000 lives saved.
Yeah. That's
50,000
huge.
lives
Yeah.
saved. That's in the best surgeon in America. The best surgeon in New York, for Gleason for PSA 10 to 20 is 69%.